Hello and welcome everybody, new subscribers, old subscribers, first time viewers, hello. I just got back from Phoenix for some TMJ treatment, and I'm going to share a little bit of information on what I have gone through and what TMJ actually is.
First of all, let's get some Dr. Lingo common misconceptions out of the way.
All of us are born with TMJ. What? Yes, that's right, because if you have TMJ, you probably know it's actually your joint. Everybody is born with their jaw joint. It's your temporomandibular joint, because you all wanted to know that. TMD is the actual disorder, which is commonly referred to as TMJ. Doctors are more and more referring to it as TMD and correcting that, and I think that's becoming more common knowledge, so many of you probably already know that. 95% of you watching this probably have TMD, and 100% of you watching this have TMJ, so it applies to all of us. The doctor I went to is a holistic dentist. I had originally gone to see him this trip for my wisdom teeth cavitations, which I highly suspected I had abscesses in. I have Lyme disease, and that's very common for Lyme disease patients or other chronically ill patients to have wisdom teeth abscesses. To the TMD part of it, as I was there, a lot of my problems we found were probably going to be corrected by doing some treatment. I have done treatment for TMJ in the past. I have had 3, I believe, different types of guards to put in. One I think was to wear during the day. It snapped in, it hurt so bad I couldn't wear it. And then the other 2 were for at night. None of them worked. They fell out of my mouth, they hurt, they didn't help. Now, he explained to me something interesting. You're wearing it at night when you're to not grind your teeth, which makes sense, and it makes sense for at night. But what about during the day? And most importantly, what about during your most high performance jaw moving time of the day, which is eating? You are not wearing them while you're eating. It's like having crutches, using them all day long, but then you put them aside and go do a sprint. That's what you're doing. You're taking it out for you to chew, and so you're sprinting on a broken ankle, sprained ankle with your jaw joint. I thought that was a really good analogy. So what they do is I'm not exactly sure how mine are going to be fitted yet, but I think they actually permanently put them on your teeth. I'm going to go on the bottom. Braces or something that I had, and after I had the braces, then I got my wisdom teeth taken out 2 years later. I had really bad pain in my jaw that started. It also started when what we thought was my fibromyalgia symptoms, which were Lyme symptoms. Just speaking of the jaw, it was hurting me very, very intensely. I was getting headaches all up here. I was getting eye pain. I was getting pain in my teeth, down all of my jaw, down my neck. I knew I had major neck issues, injuries from snowboarding, skateboarding. Those can cause TMJ problems. What happened was, after I got the braces taken off, my teeth were perfectly straight and aesthetically beautiful, okay? Wonderful, great? No, not so great. I didn't know this, but it makes sense. Orthodontists put on braces to make your teeth aesthetically pleasing. They also do things like moving teeth into places when they're like up in your gums, when they're causing pain, when you're having problems. But for me, I didn't have any of that. I just had somewhat crooked teeth. I had my braces taken off when I was about 13, 14, and everything was great. I went back when I was about 22, 23 because my teeth had gotten all crooked again. And not only that, but they were pushing, I don't know if you can see, my front teeth, they stuck out. They are pushed forward. They used to be straight down. My bottom jaw, they told me, had grown 3 millimeters, which in dentist, orthodontic, mouth stuff terms, that's a lot. That's a huge amount. And when I was just talking to my holistic dentist, he was saying that they moved my teeth to what looked aesthetically pleasing. However, it was not pleasing my jaw joint. Now my teeth were moved into a place that wasn't a natural state for me. My jaw did not like it. So the pain just got worse and worse and worse and worse until I was going to see different people to see what to do about it. What they had suggested doing is like removing 4 teeth and doing jaw surgery to move my jaw forward and putting braces back on for another 2 or 3 years and I'm like, what? This doesn't make any sense. So I didn't do it. Thank goodness. When I went and talked to the doctor now, he said, yeah, thank goodness you didn't do that. I'm finding so many patients coming to me and they're coming back after having braces a second time because the same thing happened. Their jaw grew, which it didn't. It actually was inflammation. My jaw is trying to figure out a way to bite and maneuver itself with my teeth in the positions that they're in. And it was trying to move back. Your teeth have memory, so that's why you have retainers after you get your braces off. Okay, so now that was the backstory, and there's the whole braces thing. So now getting this new treatment is going to completely put my bite back so that when I bite down, you can't really see it from the outside, but my back teeth do not touch. And actually in the CT scan and the x-rays, then my back teeth aren't touching like at all. If I put my front teeth together, there's a space. Like I can fit my nail in between my teeth with my front teeth touching. On the inside, it's a total gap. And it's very, very crooked. My jaw moved over to the side. That's probably from an injury. I'm not biting on my back teeth, I'm biting on my front teeth, and it's pushing my front teeth forward. They're gonna put the orthotics on, and it's gonna raise my teeth level up to where it should be. And then I can bite down and actually bite with my back teeth together. If I was to push my jaw back, I will show you, if I push my jaw back and bite down, my back teeth will touch. It hurts though. Oh, gives me a headache. So that was with my back teeth back to where they were before I had braces, before the inflammation and everything like that. This is my jaw now. Yeah, so it really messed things up. It's going to hopefully take down the inflammation in my jaw area and allow it to relax, and all these muscles are so tense and just constantly knotted. He was feeling my jaw and he's like, wow, like he deals with this all the time, but like mine was even more knotted than a lot of people's apparently, unless he was just saying that. He put the injections of prolozone in my jaw as well. He did one on each side here where my ear is, and then he did one down here. And these were the ones when he did my second side here. This last one, I passed out afterwards. I believe it was due to a couple things. I had just been traveling and my body had been under stress. And then putting in these huge injections into my jaw and injecting these foreign things into my body. Now these were minerals and vitamins and ozone therapy, so it's not like he was putting in like heavy drugs. However, there was lidocaine in it, and I believe the lidocaine is my problem because I've had nothing like that happen with lidocaine, but I have had pain for an extended period of time, like up to a month after having a lidocaine injection in the bottom jaw, because you have one nerve that runs along each side of your bottom jaw here along the teeth, and so it affects this entire side of your face. So that's kind of where we're at with the orthotics that are going to be the permanent orthotics. Now for the temporary orthotics, they are already, I've had them for 3 days and they're already yellowing, so excuse the yellow, it's from drinking with tea. I can't eat with them in, but I can drink with them in. So this is the temporary orthotics. Honestly, I swear it's just tea. And they just go in like this. And I had them out for the video because I still don't talk well with them in, so I'm kind of lispy. It's very comfortable. I sleep with them in, drink with them in. I do everything. I brush them when I brush my teeth. I mean, they're a part of me now. And then I had this little one that he gave me in case I wanted to use this one instead because he didn't know which was going to be more comfortable. This didn't do anything. Like, it was not thick enough. I couldn't bite right. So now here's my bite with them in. The inflammation is still in my jaw, so it doesn't change the position of my jaw, but it does change my bite. So, as you can see now, my front teeth are where they should be. They're not touching, they're not overlapping. And our back teeth are biting down on themselves. So that's what's supposed to happen. So I'm very, very much looking forward to getting the permanent ones in. I realized I forgot to add that during the 6 to 9 months of the permanent orthotics, I will have my wisdom teeth abscesses removed. And the permanent orthotics are called permanent because even though they're there for 6 to 9 months, they will not be removable. I will then have my jaw reassessed and we will decide what to actually permanently put on my teeth from there. Update on the prolozone injections. Again, they're doing good. This side still has some knots here, but this here on the lower part where I did have a lot of muscle tension is completely down to nothing. This part here, this part is a little bit, but this one is nothing. There's no inflammation there whatsoever. This one is a little bit. So every day it's gone down more. I had an extreme response to it. The very first person who's ever had a response like that. He said that people, 85 or something % of people will walk out of there with extreme pain relief. Some of them will have minimal pain relief. Some of them will have noticed nothing. That's very low occurrence, but he's never had a patient that's actually had pain from the injections. And so I do believe that the actual lidocaine plus the fact that I was just under so much stress and my body was so tensed up just really caused this. I will keep you guys updated. I'm going to be getting the new ones in February, the permanent ones. I will show you those when I get them. Please leave comments, questions. I'm happy to answer any. I hope you guys are having a great day, night, whatever it is. Bye.